This is a workshop on computer and clinical skill assessments. So the idea here is to give you an overview or the idea about how can be useful for computer-aided diagnostic, means using help of AI to make the diagnostics. And also, are there any methods or the tools that can actually help you to do the clinical skill assessments? How well you are in this clinical practices or surgery or this kind of training. Okay, so so first around 10 minutes I'll give you an overview about different applications, and afterward Mr. Binod Bhattarai will give an idea, present a tool which has been used, which can be used for clinical decision making. And I think, if I'm not mistaken, he will do some kind of hands-on as well as demo, right? Okay, so I'm going to skip this slide, and this is the first slide. So first of all, I would like to ask, how many of you are clinicians here? Right. So have you ever used any AI tools to help you make a decision, the diagnostic or decision? Do you think, are there any chances that AI might be useful, you think there is something that AI can help on this regard, and that can actually help my decision process quicker or more accurate, or something like that? Have you ever, did you ever thought about it? Right, would you like to share, what do you think, where an AI can help you? Can we get the mic to her?
Thank you. Sometimes I get very difficult patient to treat. I get x-rays, I get other lab investigations, and it doesn't make sense. And so far I'm struggling or making diagnosis based on the literature. I go back to the literature and see how the people have done similar case. But in that condition, I would have, if there is any, or there may be something which I do not know as of now, if there are some apps or something which would suggest me based on the experience of other people also, not only mine. Now I'm doing on my own experience, but I could have utilized others' experience also. I don't know about this technology, but I would love to know if there's something. I think the AI is the one which will link this. What I think so.
That's true, right?
Thank you.
Yep.
Yeah. So I work on traditional medicine, that's Ayurveda, so in my clinical practice. And I parallelly do the research for Nepal Health Research Council. So when we do the clinical practice, sometimes we may be in doubt, and in that time we need a help of evidence base. So yeah, probably the traditional method was going to the PubMed or other PubMed repository. But after I came to know about scit.ai, that was very useful, going to the traditional method, going to the Google and PubMed or Scopus articles. Beyond it, scit.ai was very fast, and I can look over whatever the best evidences and kindly diagnose the disease and give the management. That was my experience. Thank you.
Great. Thanks for sharing this, your experience. True. So the idea here is that, there is a lot of data. So now I'm talking about a lot of data, right? Previously I said, okay, that there is a scarcity of data. So I'm mentioning there is a lot of data because we are using different diagnostic tools now, right? With the advancement in this healthcare, modern tools in healthcare. So there are a bunch of data coming in through different sources, and now these data are somehow being used to train the model, AI model, for different tasks like diagnosis, prognosis, survival rate, and so, right? So now, one of the examples let's take here is computer-aided diagnostic in GI tract. So I kind of explained it before as well. So the idea here is that, on the left-hand side, you can see endoscopy. So this endoscopy actually captures the images frames, so they are shown on the middle. And these, the images are assessed by the AI network, right? So these kind of tools can be used as an assistive diagnostic tool, right? So assistive in a way like, that there can be some of the polyps that a specialist can miss out, right? So then AI can process those images or the videos. Sometimes if you use like capsule endoscope, it can be like 8 hours of videos, right? Going through each of the frame and then looking into them, it takes a lot of time. So rather than that, if we can use this kind of AI tools and help them to diagnose, like help them where the polyps are or the anomaly are, then that can be useful for the clinicians or the expert to make a decision and making the further recommendations, right? Yes, this is the one case again, like the polyp segmentation. So these are the polyp the images from endoscopes, captured by endoscopes, and the bottom row shows the boundary of the polyps in each of the images. Right, so this is the demo I already showed you before. So I'm gonna skip it here. And next thing is that, okay, so that was about the diagnostic, right? So, okay, so there is polyps and the algorithm suggests where the polyps are. So in general, these methods have certain limitations, meaning like they have to see the similar size of polyps and then it can detect. But it's not the polyp only is not the anomaly in the GI tract, okay? So there can be several other anomalies, right? And also like there can be new and emerging diseases, right? So if a model is trained on certain anomalies and then had to make an inference or the prediction on the onsen example, then it can sometimes be overconfident, and then make a wrong prediction. So we are coming up with, this is our recent research that we are coming up with the idea. So the idea here is that, okay, so we employ an AI model, and if the AI model will make predictions or the inference to only those cases it has seen before. And if there are any cases where the model is uncertain about, okay, things that, oh, this is not something my expertise, or I haven't seen such example before, then this pipeline or the solution that we proposed will allow to bring the experts in the loop, in the decision making, okay? So some of our speaker mentioned about human in the loop is the way forward. So this is also inspired by similar approach, like AI and human collaboration. So I'm gonna play a video here. So the thing is that this model actually was trained to, recognize the landmarks on typical landmarks on GI tracts, for example, cecum or Z-line and those such things. So now what it does is that, basically, if it identifies any kind of anomaly on such landmarks, then it flags that, or it doesn't make any decision. It says like, oh, this is what I can't make any decision here. So maybe you should like see, here it is unsure, right? Maybe you have to consult to the experts, right? So this is our effort to make this AI system more reliable, rather than like making overconfident prediction. Right, so similarly, other use cases where this AI can be used in assistive diagnosis is like, stenosis detection. So there is a X-ray angiography and the model can be trained to detect the stenosis. And this outcome, the predictions, given by the AI can be further analyzed by the experts. And, if there are certain cases where expert has not identified, maybe this kind of model can help you to identify the missing stenosis, okay? Right? And that would eventually improve the patient's outcome. That's what we want, right? And another case that was about the diagnostics, so maybe in the computer-aided surgery. Like this is the images from cataract surgery. So there are instruments as well as the tissues, right? Different kind of tissues there. So this kind of semantic segmentation, so the segmentations, what it's doing is that it is separating out, or there is a demarcation between the different semantic segmentation and the instrument used. So if you are doing a surgery, if you are a surgeon, and if you are doing a surgery and there is some kind of real-time feedback that, okay, there is the instrument and tissue interactions and, the interaction between the tissue and delicate delicate tissue and instrument, maybe that can help you to make a follow a better procedure, or somehow it should be useful. Do you believe on that or not? Clinicians, if you want to participate here, or want to share your experience in this case. Do you think so if such AI tools is provided to you during such kind of surgery, do you think it would be useful for you? Right, so that's moving on. So these are like, that was one of the use case in surgery. So there are several other cases and then where AI can be used as an assistive tools. And how this AI has been used in medical education is also like this. AI also has been used in medical education. So these are like performance analytics or sentiment analysis, and virtual patient simulations, personalized learning. So I'm not going into the details here, but AI can be useful in this case as well, right? And there was a question like in the last panel session that how this, the hand pose or the action recognition can be useful for in the medical domain, right? For example, this, clinical guidance for trainees, this kind of thing. So the AI is a tool there, and it basically, provides you the feedback, regular feedback based on the action that you take. So that can also be useful, right? Even to train new surgeons, right? So yeah, so there are others like chatbots can be useful, or procedural guidance, and so on. So okay, so this is the overview, like how AI can help you as an assistive tools